Secretary of State for Health, Matt Hancock.
Mr. Speaker, with permission, I'd like to make a statement on coronavirus. We're nearing the end of such a tough year where the British people have united and had to make so many sacrifices for the common good. And I know the whole House and the whole country has been cheered by the progress that we've seen in the last few weeks, which means that we can now roll out the vaccine programme that will ultimately set us free, Mr. Speaker. I can tell the House that today the NHS has begun its vaccination through GPs in England and in care homes in Scotland. And day by day, we're giving hope to more people and making this country safer. It's life-saving work. However, it will take time for its benefits to be felt far and wide. So we must persevere because the virus remains just as dangerous as it has always been. The average daily hospital admissions are up 13%. The latest figures show that the average daily cases have risen by 14% in the last week. And as before, this rise and this spread is not even across the country. We're seeing a sharp rise in South Wales, in London, and parts of the east and southeast of England. This is a trend we're also seeing in other parts of Europe, in countries like Sweden, where nearly all the intensive care beds in Stockholm are currently in use, and Germany, where they've had to announce tougher new restrictions over the weekend, and the Netherlands, who today have announced further measures. Until we can vaccinate enough vulnerable people and ensure they get the second dose so that they're protected, we must act to suppress this virus. Our strategy throughout, as set out in the winter plan, has been to suppress the virus while protecting the economy, education, and the NHS until the vaccine can make us safe. And today, Mr. Speaker, I'd like to update the House on the latest steps we're taking on this mission. First, I'd like to update the House on a new development about the virus itself. Over the last few days, thanks to our world-class genomic capability in the UK, we have identified a new variant of coronavirus, which may be associated with the faster spread in the southeast of England. Initial analysis suggests that this variant is growing faster than the existing variants. We've currently identified over 1,000 cases with this variant, predominantly in the south of England, although cases have been identified in nearly 60 different local authority areas, and numbers are increasing rapidly. Similar variants have been identified in other countries over the last few months. We've notified the World Health Organization about this new variant, and Public Health England is working hard to continue its expert analysis at Porton Down. Mr. Speaker, I must stress at this point that there is currently nothing to suggest that this variant is more likely to cause serious disease, and the latest clinical advice is that it's highly unlikely that this mutation would fail to respond to a vaccine. But it shows we've got to be vigilant and follow the rules, and everyone needs to take personal responsibility not to spread this virus. Mr. Speaker, the first formal review of tiering decisions is taking place this Wednesday, 2 weeks after the new rules came into force. However, I need to tell the House that over the last week, we've seen very sharp exponential rises in the virus across London, Kent, parts of Essex, and Hertfordshire. We do not know the extent to which this is because of the new variant, but no matter its cause, we have to take swift and decisive action, which unfortunately is absolutely essential to control this deadly disease while the vaccine is rolled out. In some parts of these areas, the doubling time is around every 7 days. This isn't just about rising rates among school-aged children anymore, but in all age groups, including the over 60s. And we know from painful experience that more cases lead to more hospitalizations and, sadly, the loss of more of our loved ones. Hospitals across the capital, Essex and Kent, are already under pressure, and we know that this doubling of cases will be mirrored in hospital admissions, and it only takes a few doublings for the NHS to be overwhelmed. Our NHS is straining every sinew to cope with the pressures, as they always do, but if cases continue to double, even they will be overwhelmed. So we must act now to shift the curve, because when the virus is growing exponentially, there is not a moment to spare. We're therefore acting ahead of the formal review date. I'm very grateful to colleagues at Public Health England, NHS Test and Trace, and the Joint Biosecurity Centre whose surveillance of this virus means that we can act very rapidly when a problem arises. We've therefore decided to move Greater London, the south and west of Essex, which includes Basildon, Brentwood, Harlow, Epping Forest, Castle Point, Rochford, Malden, Braintree and Chelmsford, along with Thurrock and Southend-on-Sea borough councils, and the south of Hertfordshire, which means Broxbourne, Hertsmere, Watford and the Three Rivers Local Authority, into Tier 3, which is the very high alert level. This means that people can only see friends and family they don't live with or are in a support bubble with in outdoor public places, and of course in line with the rule of 6. Hospitality settings must close, except takeaway and delivery, and people should avoid travelling outside their area and reduce the number of journeys they make wherever possible. Now, I know that this is difficult news, and I know that it will mean plans disrupted, and that for businesses affected, it will be a significant blow. But this action is absolutely essential, not just to keep people safe, but because we've seen early action can help prevent more damaging and longer-lasting problems later. Mr. Speaker, these restrictions will come into force at midnight on Wednesday morning, because when the virus moves quickly, we must move quickly too, and we must take the actions that are not necessarily easy, but are effective. We'll continue to stand with those who are most impacted through our furlough scheme and support for the self-employed. We've already begun to surge mobile testing into these parts of London, Essex and Kent, and we're extending community testing too. In addition, I can tell the House that this weekend, as part of our expansion of community testing, we're extending it to 67 local authorities across England. And further, today we'll be publishing a guide for colleagues to promote, support and champion local community testing and contact tracing. We'll be using millions of newly invented tests to reduce the rate of infection in areas where infection is highest and help to move down through tiers and closer to normal life. Mr. Speaker, thanks to the forces of science, help is on its way. But while we know now that that day will come, this isn't over yet. And while we deploy the fruits of scientific endeavour to make the country safe, we must do what it takes to protect our loved ones and our NHS now. I know these steps are hard, but we must not waver as we enter the final stretch, so that when we look back on this time of crisis, we can all say that we played our part. And I commend this statement to the House.
We now come to Shadow Secretary of State Jonathan Ashworth.
Grateful, Mr. Speaker, and as always, grateful Secretary of State for advance side of his statement. This is a virus that, without adequate restrictions in place, spreads with ferocity. And case rates are increasing again, hospital admissions climbing, they are edging up. Last week, the England-wide rate was 159 per 100,000. Now it's 188 per 100,000. That's a 20% increase. Across London, cases have increased 30%. Across the east of England, 36%. So none of us are surprised at the action he is taking today. Indeed, he was warned that Tier 2 wouldn't be enough to contain the spread of the virus in many places. And indeed, it looks like in some areas, such as Kent, Tier 3 isn't enough to contain the spread either. Elsewhere in the country, Tier 3 does appear to be allowing the virus, forcing the virus to flatline, and indeed the northwest is trending down. But overall, the increasing areas are rising faster than the decreasing areas are falling. And as things stand, we are heading into the Christmas easing with diminishing headroom. The buffer zone these tiers were supposed to provide is getting much thinner. So what is his plan to keep people safe through Christmas and avoid huge pressures on the NHS in January? What is his plan to support an exhausted, underfunded, understaffed NHS through January to deliver the care patients will need? And is he confident that our NHS won't be so overwhelmed in January that it impacts the vaccination programme? Now, our response throughout to COVID could have been stronger had contact tracing been more effective. In boroughs like Islington, only 65% traced by the national system. In Tower Hamlets, only 60%. In Barking, 61%. And yet Test and Trace is costing 22 billion, more than the policing and fire service budgets combined. And yet, according to the NAO, up to September, only 785 million was allocated to local council public health teams. Meanwhile, Serco have subcontracted to 21 other firms, offering little training to staff, with some in call centres, alongside others making sales calls for gambling websites. Surely it's time to scrap Serco and put all public health teams in the lead in doing the retrospective cluster-busting contact tracing we need. Now, he has promised more testing for Tier 3 areas. What about the Tier 2 areas? And on the lateral flow tests he is rolling out, he will know that some care home providers are refusing to use these because they're concerned about their accuracy. So is he satisfied that these tests are accurate enough for this purpose and are safe? And if they can't be used for care homes, how quickly can care home residents' relatives make use of PCR tests? Now, he often praises Liverpool, but isn't the biggest lesson to draw from Liverpool that people still struggle to isolate if they haven't got the financial means to do so? The eligibility criteria for the £500 payment is still too tightly drawn. People need decent sick pay. People in some circumstances need alternative accommodation. People need help with the shopping and the medicines. Surely some of the 22 billion spent on test and trace could be reallocated to offer people adequate isolation support. Now, on the variant that has been identified, our constituents will be naturally concerned. Will he undertake to keep the House updated throughout? And I'm grateful for the briefings that he has arranged for myself and others with the Chief Medical Officer. But if this variation means the virus is more easily transmissible, then fixing contact tracing and isolation becomes even more fiercely urgent. Now, finally, Mr. Speaker, today I spoke to Fred Banning. Fred is just 38. He has 2 children under 10, and he has terminal cancer. He asks that those with terminal illness are given quicker access to the vaccine. So he can, in the words that he said to me this morning, make the most of the time he has left with his family. I understand these are clinical decisions, but could he, through his offices, look into access to the vaccine for those with terminal illness and see what can be done for people like Fred and many others in this situation?
Secretary of State.
Thank you very much, Mr. Speaker. Well, I'm glad to say that across large parts of the country, there is very good evidence that Tier 3 restrictions are working and the rates are coming down. But we do need to be vigilant. And as he knows, overall, rates are no longer coming down, and hence we're having to take further action. And in particular, he talks about the lessons from Liverpool. I think the primary lesson from Liverpool is that when everybody pulls together and everybody makes the sacrifices that are necessary for their whole community, you can really get this thing under control. And I'm grateful to colleagues across London and Essex and Hertfordshire who I've been talking to today, who are committed to working to ensure that we get the public health messages out first and foremost, and to the Mayor and the Conservative candidate for Mayor, who are all committed to working on behalf of the capital and, of course, those parts of Essex and Kent and Hertfordshire that are affected, because the single best thing that we can all do is speak with one voice about what's needed to get this under control. He asked about Christmas, and my recommendation to people at Christmas is to be cautious and careful. He asked about NHS funding and staffing. Of course, we have the strongest funding in history for the NHS, and I'm delighted to say that we have more nurses in the NHS than ever before. 14,000 more nurses than this time last year, and I pay tribute to each and every one of them. He asked about contact tracing, and no doubt he will have seen the figures published on Thursday, which show that contact tracing now reaches over 80% of contacts, and I pay tribute to the team, both local and national, who are ensuring that we can get to more than 4/5 of people who we need to reach, and that has been rapidly improving. He also finally asked about Fred, the gentleman with terminal cancer who he spoke to this morning. What I'd say is that those with terminal cancer, of course, are clinically vulnerable by their nature, and by the nature of that awful disease. And we will ensure that those who are clinically vulnerable do get access to the vaccine when it is clinically appropriate. I'm very happy to take up the individual case that he raises and ensure that he gets a fair deal. But all in all, Mr. Speaker, I'm grateful for the Honourable Gentleman's support for the measures that we've outlined today, and of course support for the vaccine programme, which is rolling out across the country right now.
We now come to the Chair of the Select Committee, Jeremy Hunt.
Thank you, Mr. Speaker. These are incredibly difficult decisions, but I wholly support them because the evidence from all over the world is that in these situations, acting early and decisively is the best way to save both lives and jobs. And so close to rolling out the vaccine, it would be perverse in the extreme if we were to take our foot off the pedal. But can I ask him about this new strain, first of all? He said it's highly unlikely that the vaccine won't work with the new strain. When will we know for sure? Are there any trials going on? Is he going to get more up-to-date scientific information on this anytime soon? And secondly, can I ask him for clarity? Just 11 days before Christmas, lots of people will be thinking about Christmas shopping. From Wednesday, if you live outside London, will it be against the regulations to come into Oxford Street to do your Christmas shopping? If you live inside London, will it be against the regulations to do your Christmas shopping? And is the only way to do your Christmas shopping legally now to go online?
Secretary of State.
Thank you very much, Mr. Speaker. Firstly, his point about the new variant, that is being assessed. The question he asked is being assessed in Porton Down right now. But as I said in my statement, the medical advice that we have is that it is highly unlikely that this new variant will impinge the vaccine and the impact of the vaccine. But we will know that in the coming days and weeks as the vaccine is as the new strand is cultured at Porton Down, and then, of course, the tests conducted upon it. The question he asks about Christmas shopping is important. It is recommended that people should minimise travel unless it's necessary in a Tier 3 area, and should minimise travel where it's necessary to a Tier 3 area. And so we have taken this action to try to protect people and to try to slow the spread of this virus. And that is absolutely the right thing to do.
Let's head up to Scotland to SNP spokesperson Dr. Philippa Whitford. Dr. Whitford.
Thank you very much, Mr. Speaker. Many public health experts have questioned the use of lateral flow tests for mass community testing, especially as the manufacturers do not recommend them for detecting coronavirus in people who are asymptomatic. The Secretary of State must be aware of the paper from Liverpool University, based on his own department's quality assurance programme, which has raised serious concerns about their accuracy when used in the community testing project in Liverpool. The comparison of lateral flow tests with PCR in over 3,000 people revealed a sensitivity of just 48%, meaning that more than half of those with the virus would be falsely reassured they were negative. The test even missed 30% of those with a high viral load, those most likely to be infectious. I understand the wish to use quick tests for case finding, but surely he should now delay rolling them out to 67 other local authorities and not proceed with plans to spend £43 billion for a test which is so inaccurate. Would it not be better to focus funding on easier and quicker access to PCR tests? With more than half of all positive cases being missed, does he accept that despite the proposal by Baroness Harding, these tests cannot be used to release people who are contacts from isolating? And on the basis of this study, the Liverpool Health Protection Board have abandoned plans to use lateral flow tests to check visitors to care homes. So will he be recommending that local authorities and providers return to PCR testing for care home staff and family visitors to reduce the risk to the most vulnerable residents?
Secretary of State.
Mr. Speaker, I think that this argument against testing is wrong. I think that we should test, and that's what we're doing on this side and this government. And we're working very closely with the government in Scotland, from the same party that she represents, to make sure that we use testing as widely as possible to find people who've got this virus. And yes, of course, different tests have different characteristics. And the lateral flow tests find around 70% of those who are infectious. And that means that if you test people who wouldn't otherwise have been tested, you find the positive cases, you can get them to isolate, and you can break the chains of transmission. So I would just strongly urge her to go back, to study the details, and to back the testing programme that we have in this country.
Ian Denton-Smith.
Mr. Speaker, I fully recognise my right honourable friend's serious dilemmas. It's not an enviable position. But the application of Tier 3 to London raises some questions. In my borough, I had long conversations with public health and the hospitals, and they maintain the infection rate is almost exclusively now amongst school children and then secondary school children, and passing on to their parents, those two least at-risk groups. And so the hospitals are not overcrowded with spare beds in the ICUs, and also very low level of COVID patients in the hospitals. The question I ask him, therefore, is Tier 3 will hammer down on the one area that does control what happens, which is in hospitality. And the key area here, surely, is that in doing that, they will shift back to their homes. And it is that area where we would worry about with off-licenses selling alcohol late in the evening. Can he try and seek some kind of flexibility within this so it targets better the real risk and doesn't just hammer those that have been doing the right thing?
Thursday.
We're always open to finding new ways that protect the economy as much as possible to bring this virus under control. And I share that my right honourable friend's desire to get this under control and keep it under control until a vaccine can make us safe. But unfortunately, this is no longer just a problem in Waltham Forest and North East London amongst school-age children, which it has been until the last week's data. The case rate amongst the over 60s in Waltham Forest is now over 250, and we're seeing rising over the last week, and we're also seeing rising admissions to hospital. So whilst I have a huge amount of sympathy for everybody affected by these decisions in Waltham Forest, it is absolutely essential to get this under control now in order to protect the NHS from being overwhelmed in the future. And it is the inexorable link from cases now to hospitalisations in the future, and sadly to deaths, that we must break by using the vaccine, and we must bring down by the use of testing. But until we can have that vaccine fully rolled out and people to be inoculated by having had their second dose, and until enough vulnerable people have had that second dose and therefore become inoculated, unfortunately, measures like this are necessary.
Senator David.
Thank you, Mr. Speaker. The Health Secretary is fully aware that hundreds of thousands of jobs have been lost during the pandemic, which continues to hit our economy. This means a vast number of families and individuals are diving into hardship. Having no heating and no hot water is what many residents across our country will face this Christmas as they visit food banks. What discussion has he had with the Works and Pensions Secretary regarding the reducing the rising level of poverty?
Thursday.
Mr. Speaker, we're trying to support the economy as much as possible through all these difficult decisions. And the extraordinary levels of financial support are part of that, including the furlough scheme, now extended to the end of March. Of course, I talk to my colleague, the Work and Pension Secretary, regularly to make sure that we take the action that's necessary in the way that supports people as much as possible.
We now come to Sir Bernard.
Thank you, Mr. Speaker. May I thank my right honourable friend for his statement, albeit that it contains a lot of very grim news about the virus itself and about the effect on many areas, though it will be greeted with considerable relief in Harwich and Clacton and Colchester and Uttlesford, where the virus rates are much lower and we'll stay in Tier 2. But isn't the message now that we stay in Tier 2 or go down a tier much more by our own efforts, by the efforts of local authorities with the support of NHS Test and Trace, to make sure that we support those who have to isolate, that we track down and trace those who are spreading the virus, because by doing this and by compliance and forbearance, we can reduce the spread of the virus and we can help defeat it so that we can get down the tiers.
Yes, Mr. Speaker. My right honourable friend is absolutely right that it is in the hands of local authorities and local communities to try to keep this virus under control. And I'd say to everybody in Harwich and people across the southeast and the east of England who haven't gone into tier 3 today, that we all still need to work together and be vigilant and effectively do everything we can to stop the spread of the disease, because so many people are asymptomatic. About a third of people are asymptomatic, never have any symptoms, but can nevertheless spread the disease. I'm very grateful to my right honourable friend for the work that he's done in giving me ideas to bring forward this pact to support colleagues to help in this effort, because the links between the national system and the local authorities are getting stronger all the time, and I want colleagues also to be able to play our part, especially as those of us who through our campaigning know our communities well, to get into communities to spread the message that if we all stick by the rules and if we get the testing in and the contact tracing in, then we'll be able to keep this under control.
Let's head to Devon with Ben Bradshaw. Ben Bradshaw.
With cases in Devon down to 71 per 100,000 and falling, and COVID hospital admissions also falling, will the only reason that Devon doesn't go into Tier 1 this week be because of the shortage of staff and hospital capacity after 10 years of Conservative government cuts?
Secretary of State.
No, Mr. Speaker. Firstly, there's a record number of NHS staff, thanks to this Conservative government, and there is a record number of nurses, 14,000 more nurses. But what I would say also is that to people in Devon, currently in Tier 2, but with low rates, don't take it for granted. Let's all work together and try to get Devon into Tier 1. In Exeter, those rates have come down really sharply in the last few weeks. Let's keep working at it. And let's keep those public health messages going, not only with relation to coronavirus, but also with relation to the importance of eating fruit.
Right, we've got 8 withdrawn, so Munira Wilson.
Thank you, Mr. Speaker. We all know where to go if we run out of fruit now. My children are desperate to see their grandparents this Christmas, as is the case for many families up and down the country. But in view of these alarming numbers, and with what we're seeing in the US following Thanksgiving, and with the constant chopping and changing of rules which leads to lower compliance and more confusion, I appreciate the Secretary of State doesn't want to be the Grinch, but should he be reconsidering the Christmas measures that are in place, or do we risk unnecessary additional deaths in the new year, just as we've got light at the end of the tunnel with the vaccine?
So, State.
Well, I would recommend to people to exercise caution over Christmas, especially with respect to seeing elderly relatives who, of course, people are yearning to see. I understand that. But I think it is important that people not only abide by the rules, but also take personal responsibility in case they have coronavirus, might be passing it on, but don't have any symptoms and don't know about it.
Let's head to Essex with Robert Halfon. Robert Halfon.
My right honourable friend will know I've supported the measures, all the measures that have been put in place, and I've put my faith in the government and the scientists and medical officers. However, I've real worries about Harlow and Essex being put into Tier 3, as local hospitality businesses are really struggling and on their knees. I'd be grateful if my right honourable friend could explain how further restrictions will curb the disease, given that cases increased in Harlow during the second national lockdown. I understand that the virus recently stabilised in Harlow, and there have been no rates of increase in the over 60s in the last week. Further to this, the overall increase in cases in Harlow is 12% against a regional average of 40%. So I ask my right honourable friend to consider keeping Harlow in Tier 2.
Thank you very much, Mr. Speaker. Well, unfortunately, cases are rising in Harlow and in the districts of Essex and Hertfordshire nearby, and so we do have to take the action that we do. What I'd say to my right honourable friend, who is an incredible champion of Harlow and of his local community, is let's work together to get this down, and let's work together to get this done, and let's work together to try to get Harlow back into Tier 2 as soon as possible, not just to save lives, and to protect the NHS in Harlow, but to give people their livelihoods back too.
Jim.
Thank you, Mr. Speaker, and thank the Secretary of State for his update and keeping us okay with what's happening in relation to COVID. As a type 2 diabetic, I will take my vaccine when the time comes for me to take it and make sure everybody else gets it before I do. But could the Minister outline the response from the medical community as to the reactions to the vaccination and the safety of these drugs for those who feel, in some cases, that it's been rushed through?
On the contrary, Mr. Speaker, all of the safety checks that are necessary have been carried out. We continue to monitor the rollout of the vaccine throughout the UK, and the MHRA have done a terrific job at doing that and continue to do so. For instance, my team and the MHRA were having an update assessment on Saturday morning to check the progress of the first week's rollout. And I'm delighted to say we're able to keep doing that. And I would just say to him and to everybody else who wants to see the impact of the vaccine, look at the faces of those who've had their first dose and how pleased they are to have had it and to be able to get that step closer to protection from this awful disease.
Let's do better.
Thank you, Mr. Speaker. I note that Essex and Hertfordshire have been split into two, partly Tier 2, partly Tier 3. However, Greater London has been treated as one. In central London, our cases are significantly below the national average. And whether this House likes it or not, central London is the powerhouse of our national economy. Can my right honourable friend tell me why London has been treated differently from Essex and Hertfordshire?
Thank you very much. Mr. Speaker, as you know, we look in great detail and at granular level at the geographies that these restrictions have to cover. And unfortunately, central London case rates are rising. And we know that if an area is surrounded by other areas where there are significant increases, then those tend to move into an area if it's left out of a set of restrictions. I understand, of course, the impact on the economy, but the very clear public health advice was that London should move together because all areas of London are seeing an increase in rates and we need to stop that.
Let's head up to Greater Manchester with Tony Lloyd. Tony Lloyd.
Thank you, Mr. Speaker. The Health Secretary seems to answer rather dogmatically to the Honourable Lady for Central Ayrshire about the lateral flow test. Can I say to him that it does seem reasonable that as a diagnostic for people to self-isolate, it has validity, but with a very high false negative. Is he seriously recommending this is the first line of defence for people going into our care homes? Because if it is, I think it's a very dangerous proposition on his part.
Thank you very much. I think that it is important that we use the right tests in the right circumstances with the right other conditions. So, for instance, there is very clear visitor guidance, of which testing is one part, but PPE is another critical part. And so the nuanced question that he asked, I think, is an entirely reasonable one. The thing that I find frustrating is the idea that we should discourage people from coming forward for asymptomatic testing, where the task is to find as many people as possible who have the virus and get them to isolate. So, yes, we should ensure that visiting to care homes is done as safely as possible, and there are health upsides to visiting as well as the challenges posed by the virus. But in terms of asymptomatic testing, I would encourage people where it's available to come forward because that's how we find where this virus is and help to isolate them.